just because they were too young and didn't look like a drug addict. They were turned away, and sadly enough, they lost their life to that.
This is an overdose prevention site in Vancouver. Many people use this type of harm reduction service when they're using drugs so that if they overdose, there's someone there to help. One frontline worker says young people should have better access to these types of sites because it's not just adults that use drugs. Over 2,200 people died from poison drugs last year, and 29 of them were under the age of 19.
There was a youth that I worked with who sadly lost their life, but we discovered that they were turned away from a harm reduction service that they were expecting to use, and because of that, they were found in a parking garage, and they died sadly from an overdose due to the fact that they were turned away from a harm reduction service that could have been accessible for them.
Youth support worker Callie Sudgmore says stigma, ageism, and judgment prevent young people from using harm reduction services if they do decide to use drugs.
Youth use drugs for different reasons. A lot of times, sometimes that youth is using drugs to stay alive, and it's like parents don't want to see that. Parents just think that it's a problem that they can fix right away, and like they're sticking them in treatment or detox will work, but it's like that doesn't always work. An overdose prevention site that's youth specific would be really amazing and great.
12,000 adults in BC currently access the government's prescribed safe supply program. You have to have a diagnosed substance use disorder to qualify. The Minister of Mental Health and Addictions says that program is expanding, but youth can't access it yet. The Canadian Mental Health Association says around 68,000 youth between 15 and 24 meet the criteria for a substance use disorder.
Youth are now can be prescribed medication-assisted treatment. That's a discussion between them and the prescriber. So far, prescribed safe supply isn't available to young people. The way that we've been approaching the youth response to overdose so far has been to really front-end load the prevention, education, mental health supports.
That prescribed medication-assisted treatment could include opioid substitutes like methadone. The minister says it will take a federal change to move past the current medical model for safe supply. Sudgmore says young people will find ways to get drugs, and having safer options and places for them to use will at least keep them from dying.
We all try drugs when we're kids, and it's just part of growing up, so like experimenting's fine, but it's also just like sometimes it leads into heavy drug use, and we need to find ways to help that.
In Vancouver, Kier Junos, City News.